everyone, welcome to BJU Today. I am here with Dr. Marcelo Martinez-Ferro, who is on the School of Health Professions Advisory Board. Dr. Ferro, you're part of pioneering fetal surgery in your country, in Argentina. Can you tell us a little bit about that in a nutshell?
Yes, when I was a very young doctor, I'm a pediatric surgeon. You treat conditions on patients that will be born, and it's too late to fix them. So most of the time they will die. And I was a young surgeon, even I wasn't saved because I was saved years later. I had a burden in my heart to help those kids. And there was a doctor here in the United States called Michael Harrison, who works at the UCSF in California, in San Francisco. He's the father of fetal surgery. So when I was very young, I trained with him. And when I went back home, I worked and worked. The country was not ready, the hospitals were not ready, but I prepared myself and waiting. So to make a long story short, in the year 2001, Dr. Harrison came to Buenos Aires, and we performed the first fetal surgery in all the world outside of the United States. It was a myelomeningocele cell case, and this kid we operated him we had to open the womb, take the kid, fix it, put it back, and he was born twice. So this kid is now 17 years old, and he walks. Wow. And that was something that it was very, 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 very good. It was a big shock in the country. The country was not ready. Actually, we couldn't start the program because Dr. Harrison left. But fetal surgery program started later because it was something very, very innovative at that time.
Wow, that's amazing. That's really, truly groundbreaking for Argentina.
Well, I love to do that kind of things. But what I enjoyed most is to see the fetus as a patient. Mm-hmm. That was Dr. Harrison's vision. And we don't realize that because the womb is there and the mother is there. I mean, I was working with obstetricians and neonatologists and different specialists that each one will take care of one part, but nobody will see the baby there as a patient. Today the pregnant mothers come to my consultation, the first thing I ask them is, what is the name of the baby? And they were like, oh, yeah. So I start to talk about the patient with the name, because he is there. Mm-hmm. The only thing is he cannot talk to us or cry. I mean, he may be crying, but you cannot listen to him.
Interesting.
So fetal surgery is about, understanding the fetus as a patient. And I loved that concept.
Yeah. So how can BJU prepare their School of Health Professions students to do the same type of groundbreaking work, in your professional opinion?
First of all, groundbreaking work, that's the way you say it. I'm sorry, my English is not so good. But, we only have to be like Christ. He was the biggest groundbreaker. He just, what he did was incredible. He changed the history of the whole universe. So it's nice to be part of somebody that will change things. But you can only change things and do good things if the Lord is with you. The bigger the challenge, the more you need the Lord. So I got saved years later. I got saved when I was 42, a couple of years later after that fetal surgery. And that completely changed my vision of my profession, because I used to say, what can I do better for myself? And now I live thinking, what can I do for him, for my Lord, my Savior? So imagine a doctor who loves to do groundbreaking things, having the Lord on your side. So what can BJU do? Everything, because this is probably the better place in the whole world that can prepare a health professional to be like Christ, to be innovative. And even in fetal surgery, imagine, who else will understand that little baby there, in other places people will go for abortion. Who else can teach you better that baby is a son of God someday? He may be, one of his children. And he will need the gospel anyway. So you have to fight for him. And so I think that Bob Jones is the place in the whole world, probably, because I can't say that because I come from another place and I travel all over the world. And so, yes, that's why I love to be here supporting, being in the advisory board is a huge privilege, and I think that this is a perfect place for that kind of things to happen.
Thank you for sharing your heart and your passion for this.
Thank you.
Yeah, we enjoyed hearing it.
Thank you for inviting me. Yes.
Thank you for joining us, everyone. We'll see you next time.